Hello, everybody. Thank you for letting me spend some time with you today. I've participated or come to several events at Connected, and I just really like this place. I think it has a real nice energy to it, and I always enjoy coming, so I'm glad I get to be a part of it today, so thank you. So, as Dr. Brent said, I am Gretchen Peterson Dunlap with Peterson Chiropractic, my family chiropractic office. We've been around for almost 40 years. My dad opened his first practice back in 1985. So we've been around a while. He has mostly retired out of the office. Now my older brother, Dr. Tim, is the main doctor. My younger brother, Joshua, runs the office. His wife works in there. And then I get to do community outreach and education. So that's why I get to be here with you guys today. So usually I customize my talks to whoever I'm in front of, and I figured today it was going to be kind of a mix of people. So I thought I'd select something that we can all relate to, which are deposits and withdrawals in our bank account. And then we were just talking about money, so it kind of ended up fitting, I thought. So we know when we make a lot of deposits into our bank account, it makes for a healthy bank account, right? And as we make withdrawals, that's okay. We leave room for that. But if we do too many withdrawals or not enough, hopefully, there we go, not enough deposits, it can make for a sick bank account. Am I right? Okay, so now we're going to apply that to what withdrawals and deposits look like for our health. So, some examples of some health withdrawals are when we're constantly living in a stressed out state. That can withdraw from our health. Choosing to eat terrible food on a regular basis. On occasion is fine, but on a regular basis. Not going home and doing some exercise at the end of the day, just sitting in front of that TV day in, day out can cause a withdrawal on our health, as well as some of our sleeping habits. Some of us go to sleep with the phone in our hand. We're flipping through things that are keeping our brains engaged. The light's keeping our brain engaged. We can't just like relax and let our bodies go to sleep and get the rest it needs for the night. So those are some example of health withdrawals. Some health deposits are opposite of that. Eating healthy or at least healthier, exercise or at least moving, staying hydrated or at least drinking more water. We always can work on that, I think. And getting adjusted or at least getting your spine checked. And if we make the right choices, this is what we have the potential of, which is that's what I'm going for. I don't know about y'all, but. So getting adjusted. Why is getting your spine adjusted a health deposit? Well, it's all about communication. So our brain communicates with our entire body down our spinal cord. Everything we can see and cannot see is being communicated from our brain through the spinal cord. So it's important to keep that communication running clearly. And a chiropractor's whole job is to locate what's called a subluxation, correct it, and get the spine working properly again. And what that is subluxation is when a vertebrae gets out of alignment, starts putting pressure on a nerve, causing nerve interference. And now wherever the brain is trying to tell that body part where that nerve interference is to do, it's going to be mixed up communication. It's not going to be clear. Kind of like when you're on a cell phone and it's cutting in and out and you're not able to get the full conversation. That's what's happening between your brain and that body part if there's a subluxation. So here's an example of a normal spine. You've got your vertebrae, which is the bones, which protect the spinal cord. The disc in between, which allows us to have movement. You got the muscles and ligaments that control our movements. And then here's the nerve exiting the spine going to wherever the brain is trying to communicate with. A subluxation, a subluxated spine, is when you have that vertebrae misaligned. It's going to cause that disc to swell. There's that nerve interference we're talking about. It's going to cause inflamed joints. And the muscles tend to tighten in response to that nerve interference to try to protect what's going on. So we want to go from here to here, and that's the whole job of what a chiropractor does. So why not chiropractic? I talk to people a lot, and it boils down to this oftentimes. People are fear of getting cracked. They're fear of having to continue forever, right? That's what we were talking about. Or I'm just not in pain. I don't need a chiropractor. So we're going to look into that a little bit deeper. In our office, we don't do snap, crackle, and pop. We use a technique called the torque release technique. Our doctors use an instrument called the integrator to do the adjustment. So the patient just lays there, gets adjusted, relaxes, and moves on. There's no fear and pain involved. I have a video. Hopefully it'll work. It was giving me trouble earlier. And if it does not, then we will move on. Okay, here's my brother, Dr. Tim, doing an adjustment on one of our patients. So that is the adjustment right there. As easy and as simple as that. So it's very sophisticated, very gentle, and very non-scary. Okay, so will I have to go forever? I have questions on here, but I'm just going to ask us this. Can we cut our hair once and it's good to go for the rest of our life? Or work out for a year and be good for the next 50 years? Like our cars need maintenance, our relationships, our bodies. So our spine needs maintenance as well. So do you have to go forever? Absolutely not. It's always our choice. Is it in our best interest? If our brain communicates with our entire body down our spinal cord, I'm thinking it's a good idea to be making sure it's in check throughout your life. Okay, let's keep it going. There we go. Okay, so I'm not in pain. I don't need chiropractic. I don't have headaches and backaches. What % of the nerves do you guys think can feel pain? Just throw out some numbers. Okay, it's a good number. Would you? 100%. It's commonly said, yeah. 10%. 10% of the nerves actually feel the pain. So what do the rest of the 90% do? They're about the functionality. They're about our heart beating, our lungs breathing, our food digesting, my arms moving. It's all about the functionality. So even if you're not in pain, it's still a good idea to get your spine checked just to make sure everything else that you can't see is functioning properly. So out of everything that I've shared with you, there's only one thing you can't do on your own. You can eat better, you can drink more water, you can exercise more, but you can't adjust your own spine and you can't check your own spine. Only a chiropractor can do that. And for those of you guys who would like that opportunity, I don't want to leave you hanging, so I'm going to give you an opportunity. In our office, Dr. Peterson doesn't do any guesswork when it comes to your health. So whenever a new patient comes into our office, they're going to have a consultation, examination, any necessary x-rays, all done in-house. And then they'll come back for their report of findings where they get to see the results and see if chiropractic is a fit for them or not. Normally that process in our office, as you would expect, is $295. But because Dr. Brent let me come today, I'm offering that to whoever's interested for $79. If you're interested, the couple things are you need to make an appointment today and pay for it today. But if that's something you're interested in, I would be happy to get you scheduled. I do have to say, if there's anybody that has Medicare in this room, Medicare does not allow us to give these kind of offers. They fine us $10,000. So what I can offer Medicare patients is you can come in for a consultation at zero charge and then decide what you want to do from there. If you have any more questions about that, let me know. Do you have any questions in the meantime about chiropractic?
So how long have they been using that technique that he was doing on video?
How long that it has been in practice, I don't know. I talked to my dad the other day asking how long he's been doing it because both my brother and my dad did the popping and the cracking for a long time. He said it's been like 15 years that they've been doing it, 15 to 18.
But it's not a needle.
No.
It's going in. It's just like
It's a torque. They torque it to a certain whatever is needed, and then it pops out, and it's got like a pad at the end, so it just kind of booms. It's like, yeah, kind of, yeah.
Oh wow! Did you feel it?
Yeah. It's like a pinball. It just kind of loads up and then releases.
Yeah, and so to us, as getting adjusted, I mean, you can feel the thing, and you can feel that you got adjusted, but it's not like that. You know, the aggressive popping and cracking.
Yeah, what do they do about the neck?
They do.
Is there anything if they do use
No, they use it all the way. Yeah, my dad adjusted me way up here in my upper cervical the other day. Yeah, so they can do the whole thing all the way down to that tailbone area. Yeah.
That is very good to know.
Yeah. A lot of people like knowing that.
That's why it's fun.
Depends. I was adjusted the popping and cracking for years, and I could never just relax. You know, so. Any other questions? All right. Thank you, guys. Thank you.